Okay, so now we are going to look at some of the high yield, very important questions that are often repeated in different exams, like counseling and study design. So, first question is counseling. It is giving all the information about any disease. Counseling means giving all the information. Another one is study design, and the question related to it is penicillin and cephalosporins randomly allocated, and it is randomized control. Universe in statistic refers to population. Universe refers to population. If the population is there, that means that refers to the universe in statistics. Another one is nervous system conditions. Nervous system conditions. First topic is trauma related to piriform bone. Piriform bone trauma will damage ulnar nerve. Piriform trauma will damage ulnar nerve. Difficulty going downstairs will have nerve involvement is trochlear nerve. Bell's phenomena and Bell's palsy is upward movement of eyeball vein forcefully closing the eyelids. That is Bell's phenomena in Bell's palsy. Means there will be upward movement of eyeball and forcefully closing eye. Pupillary dilation point involved point related to pupillary dilation, there will be because of lower division of oculomotor nerve, pupillary dilation will be there. Lower division of oculomotor nerve damage results into the pupillary dilation. This is why a triad is created, that a patient will have ptosis, that will have, and patient has mydriasis and ptosis, mydriasis and anhidrosis. What will be condition? So condition will be oculomotor nerve involvement, ptosis, mydriasis, and there will be anhidrosis. So mydriasis is pupillary dilation. Light reflex present in right eye but not in consensual reflex. That is because of left oculomotor nerve. Another one is nerve block and reflexes. Now, anesthesia for difficult labor is pudendal nerve block at ischial spine. We block pudendal nerve at ischial spine. This is landmark. Damage to optic canal affects ophthalmic artery because ophthalmic artery also pass from optic canal. Sensory pathway and white matter related questions. Now, 2 point discrimination and proprioception involvement in the lower limbs. Now we have to memorize a mnemonic about 2 point discrimination of lower limbs is fasciculus gracilis. As we see, grass is present in the ground, so fasciculus gracilis can be memorized that lower limb involvement will be there because grass is present in the ground. White matter of CNS is due to myelination nerve fiber, we call it white matter. Now, other topics like cranial nerve and muscles, upward and outward motion of eye is because of inferior oblique, upward and outward. Sympathetic neurons are located in lateral horn and their function is in sympathetic activities. Now look at the some ophthalmologic conditions like visual pathway of eye and movement, difficulty in focusing on near vision because of ciliary ganglion involvement, postganglionic fibers of ciliary body are short ciliary nerves. Light reflex is lost in a patient. Patient has accommodation intact but light reflex is lost. This is Edinger-Westphal nucleus. Edinger-Westphal nucleus controls light reflex. So when it is involved, light reflex is lost. Glaucoma and corneal changes related to questions. Physostigmine is a drug. It is preferred over neostigmine. Why? Because in glaucomatous condition, physostigmine is more preferred. Hyphema means blood in anterior chamber and anterior embryotoxins are related to Chauvy's line shifted anteriorly. Now, other questions related to cornea and the lens are lens capsule is thickest at equator. It is thickest and thinnest at the posterior capsule of the lens. Outer retina is supplied by choriocapillaries. Supply of outer retina is choriocapillaries. Cardiac and vascular muscles. Questions: is specific cardiac muscles have play to phase. Cardiac muscle have play to phase. This is why cardiac muscles are not tetanized. Heart and vascular anatomy questions. Atrioventricular anterior groove veins accompany left anterior descending artery is great cardiac vein. Most common childhood hypertension caused by acute glomerulonephritis. It is most commonly happens in child hypertension. Cause of hyperventilation is COPD. Chronic obstructive pulmonary disease is a cause of hypoventilation. In COPD, there is hypoventilation and there is accumulation of carbon dioxide which results into acidotic condition. Other question: respiratory macrophage are dust cells which is very high yield and often asked in different questions that respiratory macrophage are dust cells. In pulmonary fibrosis there is decreased vital capacity because shrinkage of lung will be there results into decreased vital capacity. Mass at T12 level, a compression is thoracic duct and azygous vein. These are present at T12 level. Posterior inferior lobe auscultation of the lung correspond to T10 level. This is high yield. Okay, a 30-year-old woman with weight loss. She is 30-year weight loss, diarrhea, and hypertension. What will be the condition of the patient? She has weight loss, diarrhea, and hypertension can be because of thyroid or pheochromocytoma. Pheochromocytoma is there in this condition. Hashimoto thyroiditis occurs because of thyroid stimulating immunoglobulins or antibodies results into the Hashimoto thyroiditis. Hyperthyroidism test is TSH level performance. In myxedema, it is associated with hypercholesterolemia. Increased cholesterol level results into myxedema. So, dehydration, decreased plasma concentration of water. Kidney function and azotemia related to questions. Creatine measured by GFR and blood urea nitrogen if greater than 20, it indicates perirenal azotemia. Graft rejection is mediated by CD8 cell. CD8 cells mediate graft rejection. Most informative test for petechiae and gum bleeding is bleeding time and clotting time. Most informative test for petechiae formation, gum bleeding is BT and CT. Normal BT CT is 3 to 2 minutes. Okay, herpes zoster ophthalmicus in young patient. We will do HIV and ELISA. Foramen ovale connects infratemporal fossa to middle cranial fossa, which is foramen ovale. It connects infratemporal and middle cranial fossa. A structure passing through foramen ovale is mandibular nerve, which is high yield, also important in anatomical landmark. Daily fat consumption in balanced diet is 25 to 30%, and fat is very important for myelin sheath and nerve formation. So these were some of the high yield points related to different exams asked for different